Kelley Meade. I'm a general pediatrician. I grew up in Oakland and Berkeley, and I actually got my tonsils out at the hospital I work at, and I am really committed to the community. My father was in public service, and I was raised with a lot of altruism, I think. I trained around the country in Chicago and Boston, and I started to work in Boston, and I realized California was calling me. So I moved back out here in 1995, and I started to work at Children's Hospital Oakland. I found my calling in primary care. I really enjoyed it, and I also was really interested in how to improve systems. So I started getting involved in chronic care of kids with asthma and how we could better serve them. And I sort of entered the leadership of the clinic that later became a federally qualified health center. We spent some time working on the clinic and improving it, and we got a grant to improve the facility. It was really exciting. And I really enjoyed all the different clinics that we were able to house within the FQHC services. So we had some teen clinics, we had some school-based clinics, we had some specialty clinics for immigrant communities to our area, and we also had a clinic specifically for asthma. Later, I worked with some colleagues like Dana Long, and we worked on screening for adversity and did a lot of improvement work there on getting families connected to community services. Round about 2012, 2014, I entered clinic leadership, and I joined a program run by the California Healthcare Foundation. And at that time, I was also medical staff president, so I entered leadership of the hospital, and we were affiliating with UCSF. And after that, it kind of catapulted my career into various leadership roles, and I'm currently interim chief medical officer, as well as associate dean of academic and clinical services at the School of Medicine at UCSF. But I still love my clinic, and I make sure I get there at least once a week. And I really enjoy the community and the services that we provide there. So I think I first started working with the Alameda Alliance for Health when we were doing improvement work in our community for asthma. And they granted us some funds to do a small project to coordinate with school districts and make sure that we provided asthma care in all places that kids were living and playing and going to school. And that was really exciting improvement work. And I learned that the Alameda Alliance has deep roots in serving the community. I've always been very connected to them. When I entered leadership, I was asked to serve on their board of governors, and I serve on their strategic planning committee, which is really important work, which improves the alliance and improves connecting kids to care, families to care, and is really deeply embedded in the community that we serve in Oakland and surrounding Alameda County. I have just a little time off, but my favorite thing to do is to cook for my family. And the other thing I like to do is be in water somewhere. So I swim, I have a kayak that I started taking out during the pandemic, and I'm happy anywhere near the water. I think we're at a really exciting time in California and in our county in particular, as we're looking at reforms in managed Medicare and Medi-Cal, and we're looking at ways to really serve our community in a way that improves health all the way along the continuum. And I'm really looking forward to continuing to work with the Alliance and figure out how we can best serve our families.